In this age, when everyone who sets up a YouTube channel can call themselves an expert, I am seeing more and more of our patients who have watched videos by posture experts and are now doing things that are damaging them. Now you'll sit probably a lot more than you'd want to admit, and while you're watching this video right now, you're probably either looking down at your phone or looking at your laptop and poking your chin out to some degree, pushing your head forward. So lots of professed posture experts will tell you to stretch like this, or do chin tucks like this in order to relieve those problems. And they very often make you feel better for a few minutes. In fact, I used to prescribe exactly these exercises lots to my patients when I started practice. But that was 20 years ago and things have changed. We now know that the dominant problem with many people in chronic neck pain is a loss of cervical curve. So the natural curve in your neck should be shaped like this. It should have a deep curve with plenty of space. And that allows space for the central nervous system, your spinal cord, to sit in a relaxed posture. We're seeing an epidemic of the flattening of this curve as people poke their chins out and lean their heads forward, especially among younger generations. And this curve flattening is associated with headaches, reduced lung capacity, neck pain, spinal degeneration, herniated discs, and most importantly, increased stress in your central nervous system. Now, we already have all of these postures to compete with. So these are slouching at the TV, laptop, reading papers, texting, driving your car, and my favorite, which is texting whilst driving the car, pulling your neck into flexion. Do we really need to be doing even more into flexion? No, for sure we don't. There's a time and a place for every exercise, but for most people, these exercises, pulling yourself forward, will give you short-term relief, but long-term problems, degeneration, and pain. So, what to do when you're sitting too long and your neck is tight? Two things: change your posture and mobilize. Move your spine. Watch out for our next video on spinal wake-ups, where I explain more on how to move your spine.